Hello, and welcome to the MIMOSA Matters podcast series. In this series, we will bring you interesting perspectives on the clinical, research, and technological perspectives for near-infrared spectroscopy imaging, or NIRS, and introduce you to MIMOSA Diagnostics. I'm your host, Douglas Queen. Today, we are bringing you a MIMOSA Matters Poster Chat, where you can learn from our collaborators about their important research. Thank you for tuning in and joining us on today's podcast, where we'll be hearing from Hailey Caprara, the Clinical Quality and Compliance Specialist of Heritage Wound Care in Morristown in New Jersey in the US. Hailey is a registered nurse and a registered wound care specialist. With over 10 years of experience in wound care from inpatient and outpatient settings to long-term care and surgical podiatry across New York and New Jersey, Hailey brings clinical depth and creative heart to healing. Her passion for education drives her to design tools that empower patients and providers alike, bridging the knowledge with compassion. Welcome, Hailey.
Thank you.
Let me start our conversation by asking you a few questions about your poster entitled Enhancing Deep Tissue Injury Detection, the Role of NIRS in Early Diagnosis Across Skin Tones, such that our listeners can get some insight into your experience with NIRS imaging. Tell our listeners a little bit about your clinical practice and experience.
Sure. So I've been a wound care nurse for about 9 years now. And currently I'm working in long-term care with a wound care provider group, Heritage. We see residents in long-term care facilities that have wounds, and we are able to utilize near-infrared to help us with our assessment to have a more encompassing and detailed, accurate wound assessment.
Great, thank you. Give our listeners some background into the study featured in your recent poster at the SAWC Fall Conference.
Sure. So I was actually on routes with one of our providers, and we had a resident that it was a new admission. We were evaluating his skin, and he was probably a Fitz 4 or 5 on the Fitzpatrick scale. And on his bilateral hips, right and left hip, there were some dark areas. We looked at the areas and we debated back and forth whether this was hyperpigmentation. It didn't present as a regular DTI would present, but we were suspicious because of the location. So we utilized our MIMOSA device, our little device, and we were able to see clearly that there was no perfusion in the area. So we were able to document for the facility and the patient that these were pressure areas, not hyperpigmentation. So we kind of use that as like a springboard to say, hey, this is something that we're coming across. Other people must be coming across this too. We use that to kind of start looking across our patient population, and we had a lot of great findings.
And what was the outcome of your study?
So the outcome of the study was across the board through utilizing near infrared, we were able to do more accurate assessments across the skin tones, seeing what our eyes couldn't see. We couldn't see the deterioration of the perfusion. We couldn't see the deterioration of the tissue. We could only see what we could see with our eyes, which may only look like slight discoloration or hyperpigmentation, but with the device, we're able to see beneath that skin level.
And how did NIRS imaging help in this study?
So there wouldn't be a study without it. We can't see underneath the skin. And it's funny because I feel like everyone knows the saying, beauty is just skin deep. And in wound care, it runs even deeper, perfusion, and we can't see that with our eyes. We can take bits and pieces from our nursing assessment, feeling pulses, feeling temperature of limbs, and looking at tissue, but other than that, our eyes can't see it.
And how does this approach help with the management of pressure injuries and particularly the impact of skin tone?
So just as like the example I gave when we were on rounds, had that been treated as a hyperpigmentation and offloading measures weren't put into place, that wound could have deteriorated much more quickly and opened up. Instead of healing, it could have gotten much worse. So this could definitely change the way that we're trying to attack these wounds and offload the areas, prescribe interventions earlier to keep the wounds from opening up. We can turn back the hands of wound time.
Perfect, thank you. So what would the key message of the poster be that you would share with your clinical colleagues?
The key message across the board that we're trying to get across is that perfusion is more than skin deep. We all bleed red. It doesn't matter what color our skins are, we can only see so much with our eyes. It doesn't matter if you're a Fitz 1 or a Fitz 5 or Fitz 6. The device sees the perfusion. It doesn't see the skin tones. So that really is going to make it easier and more effective how we can diagnose.
Excellent. Well, that's all the
Sure.
questions I have for you today. So thank you, Hailey.
Thanks for having me. We're so excited to do this project and more projects in the future. We really hope that this is changing for, point of care testing and assessment and really kind of changes how we look at vascular assessment.
Thank you, Hailey Caprara, for giving our listeners an in-depth insight into NIRS imaging, MIMOSA Pro, and its utility in clinical practice. Well, that's our poster chat for today. We hope you gained some new perspectives on NIRS imaging and its utility in wound management. Be sure to visit MIMOSA Diagnostics at www.mimosadiagnostics.com and visit our social media channels. Add your comments and learnings. We want to hear from you.